Hi, I'm Dr. Amy Killen, Humanaut Health co-founder and chief medical officer. This is one of a series of videos on Humanaut's regenerative medicine program. During our time, I'll provide an overview of the Humanaut Health regenerative medicine protocols that I've designed for skin, scalp, and sexual health. At the end of this series, you'll have hopefully received enough information to decide if you'd like to take the next steps and schedule a medical consultation. You'll need to schedule a consultation with one of our licensed providers to receive medical clearance for treatment and discuss personal questions. Our administrative and scheduling staff will not be able to address personal medical questions. Before we begin, I need to share two important messages. The content covered in this series of videos is for general informational purposes only. It's not intended to be a substitute for professional medical advice from your doctor. Nor is it intended to prevent, diagnose, or cure any serious medical condition or disease. The use of stem cells and/or human cellular tissue products is not FDA approved to treat any diseases or medical conditions. The medical therapies performed at Humanaut Health, including regenerative medicine, do not claim to diagnose, treat, or cure any serious medical condition or disease. Let's dive into sexual health for women. One of the most common questions I get is, how do these therapies come to be? Like, who thought of injecting stem cells down under to improve sexual function and urinary health? The journey of cellular therapies for female sexual and pelvic health began as an extension of research into tissue regeneration and wound healing, and then later, an extension of the promising research in men showing that regenerative therapies may improve erectile dysfunction. If these cellular therapies could effectively regenerate tissue in other parts of the body and can promote better blood flow in the penis, could they also improve the health and function of the female genital tissues? Since then, we've seen a blossoming of interest in regenerative therapies like stem cells, which are being explored for their potential to enhance sexual function and pleasure, reduce urinary incontinence, and combat age-related decline in these areas. When we use regenerative therapies to try to improve sexual function in women, we are injecting either stem cells or human cellular tissue products into specific areas of the vagina and clitoris. The injections typically target the anterior vaginal wall, often referred to as the G zone, and the clitoral region. Preclinical animal studies have shown significant benefits, but clinical trials in humans investigating these therapies for female reproductive health are still in their infancy. Of the handful of clinical studies thus far, the findings of improvements in sexual satisfaction and quality of life, the reduction of scarring, and reduction of stress urinary incontinence symptoms have been the most significant. So who's a good candidate for this type of therapy? These injections work best in people who have aging-related changes in sexual function or pleasure, or mild to moderate urinary incontinence. They are unlikely to be beneficial in women with structural problems of the pelvic floor that require surgery or physical therapy, such as cases of severe urinary incontinence, pelvic floor prolapse, or pelvic pain syndromes. And regenerative procedures work best in people who are generally healthy with well-controlled blood sugar, healthy eating habits, and attention to post-procedure instructions. We advise clients to stop smoking several months before the procedure and to avoid alcohol in the weeks before and after. To get the best results, maintaining a healthy lifestyle is crucial. This includes regular exercise, including pelvic floor and core exercises, a balanced diet, stress management, and avoiding smoking and excessive alcohol consumption. What can I expect from the treatment? When we use regenerative therapies to improve sexual health, we are either injecting personal stem cells or human cellular tissue products from ethically sourced and thoroughly screened umbilical cords donated from live cesarean births. If you haven't listened to Dr. Harry Adelson's detailed explanation of regenerative medicine, cell types, and general treatment options available, please do that now. Prior to the procedure, we apply a topical numbing cream to the treatment area. We leave this on for about 10 minutes and then we clean the skin. During the procedure, injections are then performed with a small needle into the targeted areas. The number and location of injections may vary based on individual anatomy. Despite the numbing, these injections can cause discomfort, but most people tolerate the procedure well. In some patients, the injections are preceded or followed by a low-intensity shockwave therapy session. This handheld wand device is applied to the vulva and the surrounding area to try to further stimulate the healing response. After the procedure, you may experience mild discomfort, swelling, or sensitivity in the treated area. Some people note hyperarousability. Your medical provider will give you post-procedure instructions that may include complementary therapies such as intravaginal red light therapy, pelvic floor exercises, supplements, or medications to enhance the overall results. It can take 2 or 3 months to start seeing benefits. The improvements seen with regenerative therapies are typically gradual. Progressive improvements in sexual sensation, lubrication, and overall satisfaction have been reported in some studies. For those with mild to moderate urinary incontinence, improvements in bladder control may also be gradual. It's important to note that results can vary significantly between individuals, and some people may not experience noticeable improvements at all. It's crucial to emphasize that regenerative therapies for female sexual optimization and pelvic health are still considered experimental, and there are no FDA-approved cellular therapies for these purposes. Thanks for watching. If you want to see if regenerative medicine is right for you, I invite you to visit humanauthealth.com to start the medical eligibility process.